Hello, so today I will be discussing one cause of poor ankle mobility. I will also be discussing which muscles may be underactive and overactive, and then I will be showing you what type of stretch you could perform in order to help with this poor ankle mobility. So to begin, one cause of poor ankle mobility would be hyperpronation. This basically means that the ankle is twisted inward instead of just being straight. This can cause many difficulties when it comes to the ankle being stable. It can cause excessive pronation. It can increase the risk of an ankle sprain. It can also lead to rotation, tibial rotation, and femoral adduction. And this all put together will end up causing one to have valgus knee, which also means that your knee will be going inward, and this causes problems with stability, pain, all kinds of things. Now, the muscles that are underactive and overactive. For underactive muscles, it will most likely be the lateral gastrocnemius, your soleus, and your peroneus. For the overactive muscles, it would be your medial gastrocnemius, your anterior and posterior tibialis. So for the stretch, I would recommend using resistance bands. You don't have to. You can also just use your hands. Excuse me. Your hands. Basically, what you do is I would recommend getting an extra heavy resistance band just to create a greater resistance, since we're dealing with a joint rather than a muscle. What you will do is you will take the band, place it over your foot so it is right under your foot here, and then what you do is you create resistance with your arms. You sit down and now you push down with your foot. You will hold this. Since we are performing a static stretch, this is a slower stretch that is, like I said, that is held for a longer period of time. So you can hold it 15 to 30 seconds, however long you feel comfortable with, and then let go, and then you can repeat this process. Another stretch that you could perform is taking the same resistance band, pulling it over the opposite leg, so you are at ankle height. Then you create some type of resistance with the opposing leg. You push outward, and this also creates a slight stretch in your ankle. This can help with the invert, and you hold and release, and you hold again and release however long you feel like you need. Now, if you choose not to use resistance bands, you remain in the same position, but now you take your hand and either pull on that foot or you push down, and this also creates a static stretch for your ankle.